High blood pressure, also known as hypertension, usually doesn't come with any symptoms, but it can quietly raise your risk of a heart attack or stroke. That's why it's so important to check it regularly. According to the American Heart Association, high blood pressure is now defined as a top number, called systolic, of 130 or higher, or a bottom number, called diastolic, of 80 or higher. Most people use a home monitor with an inflatable cuff that wraps around the upper arm and tightens to take the reading. But here's the problem. If you don't do it the right way, you could end up with a false reading. And that could lead to being misdiagnosed, or even put on medication you don't actually need. That's why in this video we're going to walk you through the most common mistakes people make, and a few equipment issues that could be throwing off your blood pressure readings. Let's start with one of the most common issues: using the wrong cuff size. If your cuff is too small, it can give you a reading that's higher than it really is. If it's too big, your reading might come out lower than it should. So how do you know if your cuff actually fits? Most cuffs have a size range printed right on them. To check, just wrap a soft measuring tape around the middle of your upper arm while your arm is relaxed and hanging by your side. Next, make sure your arm measurement is within the range printed on the cuff. If it doesn't, you'll need a different cuff that fits properly. Getting this part right is key if you want accurate blood pressure readings. The second reason you might get a false reading: the cuff is either too loose or too tight once it's wrapped around your arm. And even if you're using the right size, this is still a common mistake. The cuff should feel snug, not too tight, not too loose. A good rule is this: you should be able to slip just one fingertip under the cuff. If it's so loose that it moves around, or so tight that you can't slide a finger in, your reading might not be accurate. Another common mistake is putting the cuff in the wrong spot on your arm. The bottom edge of the cuff should sit about an inch, or around 2 to 3 centimeters, above the bend of your elbow. That position helps the cuff line up with your brachial artery, which is the main artery in your upper arm and the most accurate place to measure blood pressure. Some cuffs might have slightly different instructions, like placing it 0.8 to 1.2 inches above the bend, so it's always a good idea to check what your specific device recommends. Just make sure you're following those guidelines every time you take a reading, so you get the most reliable results. The next part of cuff placement is all about alignment, something a lot of people overlook. Most blood pressure cuffs have a small marker on them, usually an arrow or a line labeled artery. That marker should line up with the inside of your upper arm, where your brachial artery runs. If you place the cuff correctly, the tube should naturally point down along the inside of your forearm, lining up with your middle finger. But if the cuff is twisted, off-center, or aligned with the wrong part of your arm, your reading could be way off, even if everything else is right. So take a quick second to check that marker every time before you start. You'll get much more reliable results. The next thing to watch out for is the height of the cuff compared to your heart. If the cuff is lower than your heart, which is a common mistake, especially with wrist monitors, your reading can show up higher than it really is. And if the cuff is higher than your heart, your blood pressure reading might come out lower than it should be. That's why getting the right position is so important. Make sure you're sitting upright in a chair, feet flat on the floor, back supported, and your arm resting so the cuff is right at heart level. If you're lying down for some reason, no problem. Just make sure the cuff is still level with your heart. And before you take your reading, take a minute or two to relax after getting into position. It helps your body settle and gives you the most accurate result. One thing a lot of people get wrong, without even realizing it, is wrapping the cuff over their sleeve. Even if your shirt is thin, fabric can still interfere with the reading, and sometimes raise your numbers by quite a bit. Always make sure the cuff goes directly on your bare skin. That's how you get the most accurate result. Here's something a lot of people miss. Don't just take one blood pressure reading and call it done. The American Heart Association, American College of Cardiology, and others recommend taking 2 or even 3 readings, with about a minute between each one. Then take the average. That helps filter out any random spikes or dips, so you're not relying on a number that might be way off. It's a quick extra step, but it gives you a much clearer picture of your real blood pressure. Another thing that can throw off your reading is using an inaccurate home monitor. When you get a new one, bring it with you to your next doctor's visit. Ask them to take your blood pressure using their equipment and then check it again with your machine. If the numbers are close, great. You know your monitor is accurate. But don't just do this once. Bring it in every year to make sure it's still giving you reliable results. Over time, monitors can lose accuracy, and you don't want to be making decisions based on the wrong numbers. Getting accurate blood pressure readings doesn't have to be complicated. Just avoid these common mistakes. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.